So, hi friends, good morning. I'm Dr. Anshul Bansal, again joining you on this Unacademy platform. In today's YouTube live session, we'll discuss some must-knows and very important clinical cases and clinical scenarios which are very important for your coming INICET and the FMG examination. Okay, so we'll discuss the clinical cases in form of a question where a entire clinical case with options will be given. Then I'll give you sufficient time to answer in the live chat box, and then we'll discuss the question and you can ask any doubts regarding orthopedics in the live chat box. Okay, so this is a very important lecture for the INICET FMG or the NEET PG 2022 aspirants, because these type of clinical cases and scenarios are the new trend, and they are asked in every examination. So we'll study about them, we'll practice them, and essay questions की best way to prepare for such questions or for any examination is to do the question practice of such questions, because you will ha- uh, because by practicing such questions you will do the time management. Okay, कि yes, कैसे read करना है, what are the important highlights that we have to remember, and how we have to answer the question of what should be a strategy. So very important session. So I'm Dr. Anshul Bansal. I am currently working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. And now let's start the session. And before starting this session, I would just briefly guide you about a various subscription plans that are available for the NEET PG on Unacademy. The first one is your Plus subscription. The Plus subscribers will get access to all the live as well as recorded classes. They can access the entire QBank, and they can participate in live tests and quizzes, all of which is formed by the topmost faculty for the NEET PG in India. And also we'll allow the subscribers to study on any device of their choice, because we'll allow them to log into multiple devices with the same account. And also, for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with the printed notes. While subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one and the best one is the Iconic subscription. The Iconic subscription is best not only on Unacademy but across any digital platform for the NEET PG in India. And what makes this best is that apart from the things that I've told you earlier, in extra you will get the prep ladder and all of the prep ladder, including all of its Q banks, the video lectures, the rapid revision courses, grand test, etc. Everything you will get. And on Unacademy Extra you will get well structured live batch wise classes, and we have structured a course and formulated a batch in such a way so as to build your basic concept about any subject or topic first, then going into its in depth, and we will have special focus on the conceptual based learnings and the clinical learning. Okay, and also after every test that you give, the Iconic subscribers will get an individual test assessment sheet so that they can analyze themselves, yes, this topic or this subject needs more revision, yeah, what are the types of questions, yeah, what are the things that are frequently asked in this topic, yeah, what are the things that I'm missing. So all these things are very important in analyzing as well as planning your preparation for cracking any competitive examination. And the Iconic subscription has all of this. While subscribing, you can use my code, that is Anshul B10, to get extra 10% off. Now special classes are very special. I always tell my students to please attend these special classes, because they'll give you extra edge over your competitors. Plus they are live interactive classes where you will get live classroom like feeling. You can just raise your hand digitally. You can clear your doubts there and there only. You can participate in polls, and you can watch it anywhere, anytime, but only you have to log in through a mobile application using this code, that is Anshul B10, both of which are absolutely free. And also, after every special class that you'll attend, you will be provided with the digital notes of that special class. And please do solve the QBank, and you have many options, but the QBank of Unacademy is best. Why? Not only it contains a bulk of questions, 25,000 plus questions, but the major beauty is that it contains all type of questions. Like, it contains everything that you need for cracking any type of examination. Okay, it will cover your entire theory. It will include your recall questions, the recent years questions, the high yield MCQs, recent advances, the clinical based questions, images, instruments, and the x-rays, CTs, MRIs, everything that you need. Every type of question is included in a QBank. So please do solve this QBank, and while subscribing for a QBank, you can use my code, that is Anshul B10, to get extra 10% off. Now, we are organizing a series of grand tests, all of which are absolutely free. So 24th October ko there was a INICET based. Now on 31st of October we have a FMG based grand test, which is absolutely free, and it is between 10 a.m. to 1 p.m. And remember, think it like this way: 3 hours of giving the test and 3 hours of reading the explanations and analyzing the paper. In 6 hours you can revise the most important 300 topics for your FMG. So it will be very, very high yielding as well as very important. And also we have started subject wise grand test and subject wise revision test for the NEET PG 2022 aspirants. And the first we have conducted on obs, gynae and radiology on 23rd. Now I'll tell you कि next कब है, so please do give this grand test. Okay, these are the subject wise grand test important for the NEET PG 2022 aspirants. And also we have launched a new feature called as raise a hand feature, and we have launched this feature to make a live classes more interactive, because nowadays everybody is studying from the digital platform only. And to make this platform more communicating and to increase the two-way communication, we have launched this feature where you can just tap on a button and digitally raise a hand, so that the educator will come to know about your query and you can solve your doubts and query there and there only. Okay, now focusing on the NEET PG 2022, we have started a batch dedicated to it, and also we have started a very important clinical case discussion and instruments batch. And this is important because all the things that you read clinically, sometimes they are boring and sometimes you are not able to understand that those things. But when you visualize those things कि yes, जो मैंने theoretically पढ़ा है, actual में clinically in patient it looks like this. So this will not only generate your interest, which is very important, but also it will clear your concepts, and also you will never forget the things. So please do subscribe for these courses, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Anshul B10 to get extra 10% off. Here are subscription plans for the plus as well as iconic subscription, and here you can see that the cost per month decreases significantly if you increase the duration of the course. So please do go for the subscription course with longer duration. Okay, so let's start today's session. Okay, and the first question in today's session is: 46-year-old female with the chief complaint of right knee pain that began when she heard a pop while performing yoga. She states she subsequently further injured her knee while running and now has a moderate effusion as well as mechanical symptoms. She has been unable to fully extend the right knee lacking appropriately 8 degrees of terminal extension. She is otherwise healthy, enjoys running, and has a BMI of 21. Which knee ligament is injured? And the MRI is given below. Okay, so I'll give you 30 seconds to answer this question. You can type in the live chat box the correct option. Okay, so very evident from the MRI, the correct answer is your menisci. Here the injury is to the menisci. And why? See, ठीक है. So right knee pain है, a dull pain है, progressively increasing है with exercises and running, and there was a pop sound. Okay, and on MRI you can very easily see that this is your wait a second. Yes, this is your tibia and this is your tibial plateau, and यहाँ पे you have menisci. So I have already told you कि menisci नाम याद है आप you should click in mind gadde. Okay, these are like the cushion supports or the gadda of the tibia. Okay, so here at the tibial plateau there are two menisci, the lateral menisci and the medial menisci, and here you can see that there is injury to this menisci. Okay, so the correct answer is menisci. Now there are certain important clinical things that you should know about the menisci कि इसका clinical feature या इसका injury में what are the clinical things you have. Okay, so सबसे पहले if we'll study about menisci, there are two types of menisci. First is your medial menisci, second is your lateral menisci, and in दोनों में the medial menisci जो होता है it is more important because it is the more frequently injured menisci. Okay, and why it is more injured? Because it is less laxed, yani it is more tense, and it has a connection with the medial collateral ligament. So medial collateral ligament and medial menisci both are injured साथ में simultaneously most of the time, and medial menisci, MCL medial collateral ligament and anterior cruciate ligament ACL, अगर ये तीनों ही साथ में they are injured, they form the unhappy triad of the knee called as the O'Donoghue triad of the knee. Okay, very important, remember this is important. Now menisci जो होता है उनका function, the function of menisci is your rotational stability. Remember, very important that the functions of the menisci is rotational stability, and the most common menisci injury is the open bucket type of menisci injury. Okay, now when you see, when you have any menisci injury or when you see a patient with menisci injury, there will be a pathognomic history of a click sound or a pop sound, or in Hindi you called it as jhatka. Okay, so you will have a pop sound and click sound, and there will be stiff knee, and by the manipulation of the patient himself or some attender, it will go into the position. But there is menisci injury, so if there is again wear and tear and you are not immobilizing or giving rest to the menisci, the injury will progress and it will lead to the bucket handle type of injury, which is the most important thing that you need to remember about the menisci injury. It is chronic, and generally क्या होता है कि click sound आया and you again do the exercises, but this will aggravate the injury. So this is the clinical feature, the click sound or the pop sound or the jhatka, and there are two important tests for the menisci injury. Okay, first is your, see, this first is your McMurray's test. Okay, see here also you are testing the rotational stability okay, in the supine position like this. And second is your Apley's grinding test, okay, very important. Just remember the name and the images so that you can remember ki how it is done. It is done in the prone position with the knee flexed at 90 degrees and checking the rotational stability like this, okay. So this is very important. Now we'll come to the next question, okay. So I'll write the third and fourth option here, okay. uh, a 12-year-old male with progressive swelling over left proximal arm notices ill-defined margin a month ago with dilated veins that can be seen crossing over the swelling. Local temperature is raised, CRP is normal, and swelling is mildly tender. X-ray shows irregular periosteal reaction with bony destruction in proximal humerus. Metaphysis. What is the diagnosis? First option is GCT. Second option is Ewing sarcoma. Third option is your osteosarcoma, and fourth option is your osteoblastoma, okay. So I'll give you again 30 seconds for this question. Okay, so the correct answer for this question is C or 3, that is your osteosarcoma. And why? See, 12-year-old child, yes, young adults में होता है progressive swelling with ill-defined margins and dilated veins होती है with local rise of temperature, and the characteristic feature जिससे osteosarcoma का diagnosis is confirmed in this question is your irregular periosteal reaction given here, okay. Periosteal reaction और भी बहुत जगह होती है, but irregular intense periosteal reaction in the form of sun ray appearance with a progressive swelling, irregular margins, and dilated veins in this age group is the sure shot sign of osteosarcoma. Okay, so the answer for this question will be osteosarcoma. Now, osteosarcoma is of two types. फर्स्ट इज योर प्राइमरी एंड सेकेंडरी. कहीं पे कुछ भी नहीं लिखा हो तो इट इज प्राइमरी और द मोस्ट कॉमन टाइप. इट इज जनरली सीन इन यंग adolescent एज ग्रुप एंड there is no previous or there is no pre-malignant bony lesion that is present. In secondary, it is most commonly in the elderly population and there is a bony lesion already present in secondary osteosarcoma. So we'll read about the primary osteosarcoma, and most commonly in the lower limb bones and at the metaphysis it is seen osteosarcoma, okay. So here you can see a swelling. Most common site is your distal femur. Metaphysis of the distal femur is the most common site, and there will be mild pain, swelling, occasional pyrexia, but this occasional pyrexia is the characteristic feature of the Ewing sarcoma. That's why you have to differentiate Ewing sarcoma clinically with osteomyelitis. There can be pathological fracture obviously, and there can be metastasis, most commonly in the pulmonary trunk or the lungs, okay. So here you can see this is the sun ray appearance or the sunburst appearance, the irregular periosteal reaction, which is the characteristic feature, breaking the periosteum and going into the soft tissue, okay. So new bone formation, the periosteal reaction will be there. Codman's triangle is the subperiosteal view में initial periosteal reaction में होता है, and it is seen in variety of cases even in Ewing sarcoma etc. So this is not the pathognomic feature, okay. Here also you can see the osteosarcoma with irregular and intense periosteal reaction. So this is your sunburst and this is your Codman's triangle. Now, one thing that you need to remember is the periosteal differentiation between Ewing sarcoma and the um, osteosarcoma. Very important. See, the bone tumors are very important. हर साल at least one question in any examination, सब examination में at least 1 to 2 questions come from this topic, and इस topic में से 3 things are very important, and they are the GCT, the osteosarcoma, and the Ewing sarcoma. Mostly questions come from any of these 3 topics. So Ewing sarcoma में जो periosteal reaction होती है, it is regular in form of layers, and it is called as the onion peel appearance. Okay, it is called as the onion peel appearance. Here you can see a characteristic osteosarcoma: irregular margins with large progressive swelling with dilated veins. Here you can see. So this is of the proximal humerus and this is of the distal femur. So this is your osteosarcoma. Okay, so एक और चीज important ये कि osteosarcoma has a bimodal age peak, where the first peak is that occurs, it is during the adolescent, like between the 10 to 19 years of the age or 18 years of the age, and the second peak is after the adult older adulthood, that is the secondary osteosarcoma. Okay, so इसका treatment, first of all staging diagnosis करके you go for the pre-op chemotherapy, and now amputation is the choice. But before doing the amputation, because generally the patients are young, and if it is diagnosed early, then you can go for the limb saving surgery, where you can do the surgical resection with large margin and reconstruction obviously, and then supporting it with the pre-op chemotherapy. And remember, Ewing sarcoma जो होता है, that is the highly radiosensitive tumor, so there the treatment of choice will be radiotherapy. Okay, so yes, I guess there is some problem in the slides this time. Wait, let me check it once. Okay, now this is your next question. A 15-year-old male A 15-year-old male with complaint of swelling over left shoulder, X-ray done revealing osteolytic lesion in epiphyseal region of proximal humerus with stripped calcification. Surgeon recommended biopsy of lesion post X-ray, while the pathologist has reported biopsy with a mixture of fibrous matrix and scattered giant cells. The diagnosis is very good question, and here are your 30 seconds for this question. Okay, so 15-year-old male, osteolytic lesion proximal humerus में epiphyseal region के अंदर है, and there is stripped calcification. Okay, and pathology में you will have a mixed matrix with scattered giant cells. तो ये GCT आपके दिमाग में आता है. So keep it in the option. Chondroblastoma, yes, same picture of chondroblastoma. Fibrous dysplasia, there is epiphyseal sorry, it is not epiphyseal, it is metaphyseal with osteolytic lesion but no strip calcification, similar with the chondromyxoid fibroma, no giant cells in both these two. So in दोनों में there is giant cells but an osteolytic lesion, but remember GCT में there is no calcification. Okay, there is no calcification, so the answer is not GCT, the answer is chondroblastoma. So एक और ऐसा ट्यूमर है apart from GCT जिसकी histopathological imaging में you can see the scattered giant cells, and this is your chondroblastoma. And remember this stripped calcification. Okay, this is the characteristic feature of the chondroblastoma which makes the diagnosis here as chondroblastoma, not the GCT. And now this is very important, तो इसको अपन याद रखते हैं कि कौन सा ट्यूमर is from which region of the bone, and sometimes it is confusing, but examination point of view से it is very important. So remember M के बाद N, but N से you don't have any tumor, so O. जो भी tumors, all the tumors which are arising from the O alphabet are M for metaphyseal. Okay, like osteoma, osteoid osteoma, osteoblastoma, and osteosarcoma. O के बाद you have N से there is no region in the bone, but M you have metaphysis. So O से start होने वाले all lesions are your metaphyseal. Okay, very important, remember. Similarly diaphysis, so diaphyseal जो होते हैं C D E. Okay, so C and D से C and E से start होने वाले जो भी bony tumors हैं, these are your diaphysis. Diaphyseal is the most common site, and the common example like in here chondroblastoma, but this is an exception. Remember, it is most commonly seen in epiphysis. Okay, other you have the Ewing sarcoma, etc. Okay, now एक confusion, and rest all are from your sorry, C D E. Okay, so diaphyseal is your Ewing sarcoma and the N chondroma. So here remember C, don't remember this SC. D के बाद there is E, so you will have E से start होने वाले जो भी tumors होंगे, that will be your diaphyseal in origin, and rest all will be your epiphyseal in origin. Okay, so now the answer, the most important thing is about the GCT. So GCT में there is two important things that you need to remember. The first is your most common site. The most common site is your epiphysis, and the most common site where it presents is the epiphysis. And arise, अगर आपसे पूछे कि start कहाँ से होता है, site where it arises, it is your metaphysis. Okay, and एक और बहुत important चीज about the GCT that you should remember is that GCT presents after the fusion of the epiphysis. हमेशा epiphysis fusion के बाद ही there will be the giant cell tumor or the GCT. Okay, this is your GCT, and here you can see this is your GCT का soap bubble appearance. Very easily you can see here. Okay, and this is your chondroblastoma, where you can see the epiphyseal eccentrically placed lytic lesion with triple calcification. Here you can see beach में. Okay, which is seen in case of around 50% cases. Okay, and see this is your chondroblastoma. Okay, here, and histopathologically you have a characteristic scattered giant cells, and दो characteristic चीजें होती है. First of all, the giant cells, and second is this your chicken wire appearance of the tumor cells के calcification की वजह से. Here calcification of the tumor cells की वजह से you will have the chicken wire appearance. This is fibrous dysplasia, and it is most commonly the metaphyseal area में, and it is lytic lesion with no calcification, and similarly for the chondromyxoid fibroma. Now we'll come to the next question. A 16-year-old girl who plays tennis on a high school team is brought to the emergency by her parents because she has had pain and worsening swelling of the right knee since she sustained an injury during a match 4 hours ago. The patient says she was playing on a hard court and fell directly onto her knee. She was able to complete the match. The pain is localized to the anterior aspect of the knee, dull in nature. The patient rates the pain as 6 on a 10-point scale. Physical examination shows a fluctuant mass over the patella. Full range of motion is noted. Muscle strength is 5 by 5. Result of apprehension test is negative. Which of the following is the most likely diagnosis? Here are your 30 seconds. ओके सो 16-year-old गर्ल है, acute इंजरी है और डायरेक्टली ऑनटू अ नी एंटीरियर एस्पेक्ट पे है एंड important thing that she is able to complete the match and there is full range of motion. That means there is no fracture and no dislocation, because fracture या dislocation में you will not be able to do the movement, especially you will not be able to complete the pain, and pain is not dull in nature. So dislocation is not the answer, fracture is not the answer. Now the answer is between patellar tendinitis and prepatellar bursitis. So remember anterior aspects. So patella के ऊपर there is suprapatellar bursa, patella के in front, that is anteriorly, you have prepatellar bursa, and below patella there is you have the infrapatellar bursa. So anterior aspect पे prepatellar bursitis plus tendinitis and etc. are generally the chronic cases where there is progressive pain etc. Okay, so here the clinical scenario history all favors the diagnosis of the prepatellar bursitis, and prepatellar bursitis ka there you have a special name because it is more very common in a group of population, that is your maids. So it is also called as your housemaid's knee. Okay, similarly you have a clergyman knee. Okay, similarly you have a clergyman knee, and this clergyman knee is due to the infrapatellar bursitis. Okay, it is due to the infrapatellar bursitis. Remember this is important, and this is your patellar apprehension test. This is how you do. In the supine position you flex the knee over the side of the table, and then you slowly flex the knee and extend, and then you have a pain that is apprehension test positive. It points towards the instability of the knee joint, generally the patellar dislocation etc. Okay, so here the answer will be your prepatellar tendinitis. Okay, now we'll come to the next question. Next question, this is a very important question because similar type of question has been asked in the INICET before, so that's why I have repeated it. This we have already discussed this question in our previous session. A 35-year-old man comes to the OPD because he has had pain and swelling on the right knee for the past 3 days. Also for the past 2 days he felt feverish. Person is able to ambulate, that is walk, but walking exacerbates the pain. Temperature is 102.7 degree Fahrenheit, that is patient is febrile. On examination right knee is red, warm and tender. Large effusion is noted. Which of the following diagnostic studies of the knee is the most appropriate initial step? Okay, here are your 30 seconds for this question. ओके सो वेरी इजी, जो भी क्लिनिकल हिस्ट्री एंड केस you can very easily diagnose at least this, that there is an infective pathology and there is an acute septic arthritis. Okay, now acute septic arthritis में arthroscopy you will not done, bone scan you will not done, you can go for the MRI and the arthrocentesis, but remember the initially you will do go for the arthrocentesis. Now what is arthrocentesis? Arthrocentesis is nothing but taking a sample or aspirating a pus from the arthritic joint or any area with the use of needle. Okay, and why it is the initial step? Because you cannot start the antibiotics before going for the culture and sensitivity or examination of the culture, because a single dose of IV antibiotics can make the pus culture that you will send afterwards will the sterile one. Okay, so that's why firstly you go for the arthrocentesis, you take aspiration, you take the sample, you send it for the various investigations including culture and sensitivity, then you start the antibiotics, because without antibiotics patient will not recover, and the pain, the acute signs of inflammations will not go. Okay, and then you can go for the MRI to see the planes where the pus has drained, so that you can drain the pus and remove the necrotic area. So the initial management will be your arthrocentesis, and you do like this. In case of knee, you do what you do, you just feel the suprapatellar margin, matlab the superior margin of the patella, and just above it you insert the needle and take the sample. Now next question, very easy question. A male neonate who delivered vaginally at term 1 hour ago has a deformity in the right foot. On examination, plantar flexion of the ankle, inversion of the subtalar joint, and medial subluxation of the talocalcaneal and the calcaneocuboid joints are noted. The position of the foot cannot be passively corrected. Which of the following is the most likely diagnosis? Okay, so here are your 30 seconds for this question. Okay, so the answer is very easy. That is congenital clubfoot, and calcaneovalgus nahi hoga, because plantar flexion, that means there is equinus deformity with inversion yani varus, the equinovarus deformity, and also medial subluxation or adduction, that is varus. So equinovarus deformity, which is congenital clubfoot or CTEV. In calcaneovalgus, the child will will walk on the calcaneum, or in case of neonate there will be dorsiflexion, that is towards the shin of the tibia. So that's why calcaneo, this is calcaneo, and valgus there will be eversion or the lateral subluxation, and so that is calcaneo valgus nahi hai. Pes planus and tarsal collation are different things. Okay, so we'll read ki kya hota hai. So the answer is congenital clubfoot, that is CTEV, very important. Okay, in pes planus the deformity is correctable. Okay, and in tarsal collision syndrome, neonates mein it is not at all present. It can be present in early age group like less than 5 years, or most commonly in the adult, that is 20 to 30 years of the age group mein. So this is your congenital clubfoot CTV. This is your pes planus, that is the flat foot, that is your pes planus. नाम से पता चला planus means plane, and pes cavus is exaggerated medial arc. Okay, like this is your pes cavus, but remember these are correctable. Okay, मतलब correctable तो CTEV भी है. By manipulation alone you can temporarily also correct that. Okay, and now normal foot is this one. एक और disease होती है similarly, that is your metatarsus adductus, और here the metatarsal bones जो होगी they will be deviated inwards, that is inwards means towards the medial side, yani they will be deviated medially. This is your metatarsus adductus, and this is your calcaneum valgus, as I have told you, and the calcaneo navicular talocalcaneo collision, नाम से पता चला collision, so there will be fusion or abnormal connection between these bones. Okay, now next question is, a 54-year-old female presents for evaluation of left shoulder pain. She previously sustained a proximal humerus fracture 8 months prior and underwent surgical fixation. She complains of persistent fracture site pain, denies any current numbness or tingling of the left hand or arm. The patient is left-handed dominant and is the sole provider and caregiver to her elderly father. Shoulder motion is limited secondary to the pain. Patient has normal range of motion of the elbow and the wrist and is neurovascularly intact. For management of the patient's non-union as seen in the image, what would you do? This is the recent x-ray of the patient, and here are your 30 seconds for this question. Okay, so here you can very easily say that this is a typical case of old fracture with non-union, and there is ILN humerus in situ, or interlocking nail humerus in situ. So now what you will do, first of all, there should be grafting. You cannot manage it conservatively. The head, the articular surfaces are normal, so arthroplasty you will not do. Now either you can do the revision IMN and bone grafting, but no, you will remove the nail, you will put the bone graft and fix it with the plating. Okay, that is open reduction internal fixation with plate and screw. So the answer will be second, that is nail removal with RF plating and bone grafting. Okay, very important. Now next question, a 87-year-old female presents after a fall down one step at home. Fall was directly onto the left hip and she reports isolated left hip thigh and pain. No other injuries was there, and she denies loss of consciousness. The patient has lived independently and uses no assistive device prior to the fall. A focused physical examination of the lower left extremity reveals deformity of the leg, including shortening and external rotation. The pain at the hip with any movement of the leg. No other injury noted. Sensation motor are intact and distally two pulses are present in the foot. How will you manage this injury? And here is the x-ray, and here are your 30 seconds. Okay, so first of all, this is left-sided fracture, intertrochanteric fracture femur or IT femur fracture. Okay, ये diagnose हो गया. Now it can be done by conservative because this is a fracture which always unites ORIF and plating. No arthroplasty, no need of doing the arthroplasty. Or femur nailing also you can do. Now even if it is reduced or unreduced nowadays, to increase the mobilization, early mobilization, and to reduce the drawbacks of the conservative management like stiffness and the Sudex dystrophy, prolonged immobilization, bed rest, etc. The treatment of choice is your nailing in case of IT femur, that too not simple intermedullary nail of the femur, a special proximal femur nailing or proximal femur nail. Okay, so the answer for this question will be 3, that is proximal femur nailing. Okay, now this is very important for the INICET examination. It has been asked 2 times already, that's why I have again included this question. Okay, so INICET में ऐसे ही होता है कि question topics are repetitive, just they change the thing that they want to ask, or some options and the question framing, but the topic or जो, the subtopic is the same. So all of the following are included as yellow flag signs of lower back pain, except. Here are your 15 seconds. Okay, so the answer for this question is your history of systemic steroids. It is a red flag sign. Rest all are yellow flag sign. That is back pain relief. Believe that back pain is severely disabling. Okay, reliance on passive treatment, social isolation. So these are all the yellow flag signs. So red flag signs जो होते हैं, these are possible indicators that there is a serious spinal pathology. Okay, these are the red flag sign. And in the yellow flag sign, what you will have, you will they are generally the psychosocial factors related to the psychiatry or the anxiety. So these are the yellow flag signs, very important, read them. Okay, so this was all about today's session, where we have covered very important must know INICET and FMGE examination. So thanks for watching my video. Please like and share and subscribe if you like the video, and you can use my code, that is Anshul B10, while subscribing for any of the course on the Unacademy to get extra 10% off. Okay, so all the best to everybody. Do well in your INICET examination. Okay, prepare hard, focus on the questions and the previous year MCQs, and it is easy. It is not something, that kind of examination which you can't